because of the fact that it devastates the gut. And the gut is where we generate our immune system. So it can't be good for us. Now, maybe it hasn't been proved to create brain tumors like aspartame has yet, or it's not quite as devastating, but it's still not going to be good for us. But don't be discouraged. As we mentioned earlier, nature's pharmacy is very tasty. And there are certain herbs that nature produces that are very sweet, one of them being stevia. So one option for you is if you like sodas, and don't drink them very often because they're very acidic, but if you like sodas and you want to have a diet soda, there are sodas now that are sweetened with stevia. So you don't have any of these toxic additives like aspartame or Splenda being added to the drink. It's a good option.
From a simple. And
It has no toxicity, and it's absorbed by cancer cells 70-1. We wait 24 to 36 hours after administration. This way, most of the cancer cells, if not all, will absorb it, and normal cells release it. We don't know the mechanism why normal cells release it. I think it's a God thing, but that's another story.
But it works.
But it works. Okay. So cancer cells retain it, but this substance by itself does nothing till we wake it up or activate it. And that is done using sound therapy of specific frequency, amplitude, intensity. Okay. And this is something that patients could do not only while they're at home for cancer, but for an extended period of time at home as a home program because it's totally non-toxic.
Right, and then we got the photo part.
And then we have the phototherapy, and this is as you see, it has red lights, blue lights, and a row of lights that are not on, but guess what? They are on. It's just invisible light in the near-infrared spectrum. Okay. So photodynamic therapy will also wake up the sensitizer and allow it to activate itself within cancer cells, and that forms oxygen radicals, O-. And O-, as you know, are toxic to cancer cells, and they set off the apoptosis or programmed cell death. In addition to that, it provides a local inflammatory response, so thereby the immune system can come and target that area. Now we're going to the hyperbaric oxygen chamber room, and here we have hyperbaric oxygen. What this does is the patient comes in here, it's lying down, very comfortable. We're increasing the pressure of oxygen to about 4 to 4.5 pounds per square inch. So we know oxygen and cancer don't combine. And so the 1 hour that the patient is in here, you're saturating the cells with oxygen.
Well, what's the normal pressure? You said 4.5 pounds per square. What's the normal pressure?
About 1.3.
So it's like 4 times as strong.
Exactly,
okay.
Yes.
And so that pressure is then forcing oxygen into the cells.
Yes. And patients love this therapy because you feel that oxygen load. Mm-hmm. And some patients tell me, can I stay in here 2 hours or 3 hours? Literally, you can, right? Because you can't get too much oxygen in this sense, but 1 hour is the duration of the treatment. Okay. This is one of the preferred treatments at Hope for Cancer, not only for its efficacy, but because it allows the patient to relax there for an hour. You kind of are in a bubble, and you forget of what the fears and the conflicts that you have. It's just a good therapy in that sense as well.
In January of 2007, I was diagnosed with invasive bladder cancer. The recommendation and the mainstream medical treatment for invasive bladder cancer is to remove the bladder, prostate, and surrounding lymph nodes. Okay. This treatment had a cure rate of about 90% and would not require chemo or radiation.
Okay. So that's what you went with?
Yes, my daughter was 11 years old at the time of surgery, and I wanted with 90% shot of cure. That's pretty good odds. Mm-hmm. So I went with the surgery. However, when they did the surgery, they found that the cancer was also in my lymph nodes. This was previously undetected on my initial test. So suddenly I went from a possible cure rate of about 90% down to about 40%, okay. And I was going to have chemo. The initial procedure, when they thought it was just confined to my bladder, I was only going to have surgery and no chemo and no radiation. My surgeon set me up with an oncologist, one of the best around.
Okay.
When I met with the oncologist, he requested another scan. So the scan results came back. I had 3 tumors in my liver that were previously undetected on the initial scan.
Okay.
At that time, I asked my oncologist, was there a chance of a cure? He said, not really. He added that with bladder cancer metastasized to the liver, that the average life expectancy was 9 months. Some people die in 4 months, and he had never seen anyone last longer than 12 months. My brother, his wife, my wife, and I really started researching alternative cancer treatments, clinics, and so forth. May of 2008, I came to Hope for Cancer. I completed an inpatient program and continued with their home program. And I'm proud to say that since then, all of my tests and scans have indicated I am cancer-free.
Wow, that's awesome.
It is awesome.
That is.
It's a great day to be alive.
It is. Wow, 7 years.
7 years and counting.
Yeah.
You count every day, every minute.
I tell you what. And that's from a pretty bleak prognosis, right? Less than a year, you're alive.
Yeah.
8
Well,
years later.
Yeah, my urologist who did the initial surgery says that I'm a miracle. My oncologist says that he's never seen anyone with bladder cancer metastasized to the liver free of this surgery.
I'm glad you're the first.
Hey, it's good to be in that group of one.
It is, isn't it?
This one.
And now your 11-year-old girl is 19?
Well, at the time of that initial prognosis of maximum 12 months to live, I didn't think that I would see her even through middle school. Now she's graduated from high school and just completed her first year of college.
That's so awesome.
It is awesome.
This is pulsating electromagnetic field therapy. Again, to affect the cell, we could pulsate water, we could pulsate the cells, we can help reduce the tumor size by energy, okay? And can I try it on you, Ty?
Absolutely.
Okay.
Sure.
So,
We're going to sit down here?
yeah, why don't
Okay.
you have a seat, please? Make yourself comfortable. I know you've had a long day.
I'll
and,
take- I'll
this will
take
be
any-
very
any
beneficial. Let's
relaxation I
put
can
this
get at
around
this
your
point.
neck.
Okay.
And
You're not tying this to a truck or anything, are you?
no. So we'll start with a 3-minute session. I'm going to increase the intensity. You're going to feel maybe your muscles jumping a little
Okay.
bit. And here we're affecting. You're beginning
Yeah.
to feel that?
Yeah, feel the twitching.
Yeah,
Yeah.
feel the twitching. So now we're sending electromagnetic fields. This goes back
That's interesting.
to the Papimi in Greece when this was developed. Back many years ago, it was like a washing machine. Now technology has consolidated it, and we have it this
Wow, this
small.
is really interesting.
Yeah, it's very good for pain,
Okay.
very good for inflammation.
I've been having pain in the back of my neck. Should this help?
That should help. We're waiting for the 3-minute cycle to finish.
Oh, I like this though.
Yeah.
It actually feels good.
Yeah, it does.
Yeah. After the very first. The first it was kind of odd, but now it feels good. If that's
So, Ty, is it done?
it. Yeah.
You want to see what we just, what kind of energy we gave you?
Yeah.
All right. Can you stand up for a second,
Sure.
please? And hold this like this.
Yeah.
Okay. This is a chain, as you see.
Wow.
So I take it, it closes the loop.
Some serious energy.
Serious energy. If I crank it up more, maybe we could take it this way
Okay.
so they can see it. Hold the bottom.
Okay.
And, see, but then when it forms a loop, it stops.
Right.
I take it away, and it's stabilizing the energy pattern.
Wow, that's interesting.
Very powerful.
Yeah. So this is the favorite treatment of many patients, huh? The PEMF.
Yes, for sure.
Yeah.
Very simple to use, very effective, and one of the staple treatments at Hope for Cancer.
Very cool. Thanks for showing me.
Surely.
Yeah,
I'm
I
glad you enjoyed
appreciate
it.
you letting me be the guinea pig. It was enjoyable, actually.
Okay, excellent. This is a near-infrared sauna as opposed to a far-infrared sauna.
So, Dr. Tony, what's the difference between a far infrared and a near infrared? I've got a little personal far infrared at the house, But I think it was one of your patients today that I talked to. He said, no, it's not far infrared, it's near infrared.
infrared.
What's the difference?
Near infrared light has a greater depth of penetration than far infrared. Near infrared light is more detoxing. You know that saunas and infrared light pulls out toxic and heavy metals, right? Also, most far infrared saunas in the market have too much EMFs, electromagnetic fields, that are toxic, like a cell phone, right? There's a book called Sauna and Detoxification by Dr. Lawrence Wilson, MD, out of Arizona. And there he's considered the guru of sauna therapy. And, he talks about what I just mentioned to you, the importance of using near infrared as opposed to far infrared.
So near infrared is less EMFs and it penetrates further.
Here we have local direct hyperthermia. What is hyperthermia? High heat. We know, science knows, that cancer cells are heat sensitive. Normal human cells are heat resistant. That's why when we have a flu, a virus, an infection, we get a fever to kill the bugs, but it doesn't kill our healthy cells. Right? So now even in the US, they're using hyperthermia with radiation, and they're saying, wow, the results are better. Well, of course, because most of the damage selectively to the cancer cells are being done by the local hyperthermia.
And so that's what this is. It's a
This is
local
what this is.
hyperthermia machine.
Yes, and it's a very easy, non-invasive therapy. This is the one. Of course, if let's say the patient has a tumor in the breast, right? We put a conductive gel, natural, non-toxic. We crank up the device, and then the treatment is done externally.
Okay.
And this is using both capacitance and resistance, different types of energy to get to superficial as well as to deep tumors. This is another favorite tie. I know I told you several of them are favorites, but this is not only a field of therapy, but a very effective therapy. With the combination of sonophotodynamic therapy and local hypothermia, we're getting at least a 52% decrease in blood supply to the cancer tumors or masses during the stay of the patient here. We know that angiogenesis, right, is one of the characteristics, hallmarks of cancer. So if we could decrease the blood flow to the tumor, we're well on our way to having an effective therapy.
Yeah.
And, maybe you saw some patients today who had an 80 or 90%.
We did, as a
Yes.
matter of fact. Now, as opposed to what we've already seen with the near-infrared sauna, that's also hyperthermia, isn't it?
Correct.
This is just a different machine that does the same thing?
Not exactly. It doesn't do the same thing because that's more for pulling out toxins. That's more for superficial opening up of the pores, for cleansing, detoxing. This, local hyperthermia, and we also have full body hyperthermia here, is a therapeutic treatment for cancer.
Okay.
Meaning it's going after the cancer cells, it's going after the bugs.
Got it.
The viruses, the bacteria, the fungus.
So it's good doing both.
It's good doing both. Yes.
Great. So just to summarize Dr. Tony's protocol there at the Hope for Cancer Clinic in Tijuana, he uses sonophotodynamic therapy, hyperbaric oxygen chambers, far infrared and near infrared saunas, a drastic change to the diet, restricting sugar almost completely, and my favorite, as you saw, was the PEMF, which is pulsed electromagnetic frequencies. If you saw him put that little thing around my neck, he could have turned up the voltage. It probably would have